Assalamu alaikum. Good afternoon from Malaysia. I think it's the time we should start.
Yep. Walaikum assalam.
Welcome to the 24th monthly MedEd webinar. This webinar completes our 2 years of this webinar series. And today's presenter is Dr. Rukhsana Hussain Malik. And I'll straight away go and invite her for presentation. So you can share the screen.
Assalamu alaikum and very good afternoon from Malaysia. Thank you for all the participants for joining this webinar on the learning environment. It's just a bird's eye view of the learning environment because it is a very, very huge topic and practically it covers everything which is happening in the university and what the students and the staff and the other people go through in that environment. So I'm going to be touching on most of the topics which are pertinent and which are important from the students' perspective, but also on the topics which are important from the staff perspective, because I think the environment is not completed if only we talk about the students and we don't talk about the staff members who have their own issues while they are performing their duties and their activities in the universities while teaching the students. So the learning outcome of this session will be that after attending this session, the participants would be able to describe the learning environment, discuss the factors which affect the learning environment, measure the learning environment in their institutions, and after that, they are able to improve the learning environment of their institutions. What actually is the learning environment? Everything that happens in the educational institute that motivates or demotivates the students in the learning process constitutes the learning or the educational environment. It is called as I'll call it the LE learning environment or EE educational environment or the climate. This is the definition which was given by Jen in his article in 2001, and most of us really considered this to be the most precise definition of the learning environment. It is the manifestation of the effects on students of the various parts of the curriculum. Practically, if you look at the definition of the curriculum means, sorry. Okay, the expert said that the voice is muffled, so he has to adjust the things a little bit. Sorry for that interruption. So I start again with the introduction. Everything that happens in the educational institute that motivates or demotivates the students in the learning process, it constitutes the learning or the educational environment or the climate. If we remember the definition of the curriculum is everything that happens in the educational institute is the curriculum. So the definition is slightly modified according to that. It is everything that happens that motivates or demotivates. So practically it brings in the learning process of the students into it. that constitutes the learning environment. It is the manifestation of the effects on students of the various parts of the curriculum. The American Medical Association defines learning as the environment as a social system that includes the learners, the peers, the teachers, the setting, and the purpose of interaction, and the formal and informal rules that govern these interactions. The social interactions, organizational cultures and structures, and the physical and the virtual spaces that surround and shape the participants' experience, perceptions, and the learning is the definition given by the Macy Foundation in 2018. Educational environment or the learning environment is divided into three parts. The physical environment are the facilities, the comfort, the safety, food, accommodation. Those are the physical things which affect the students' teaching learning processes. The emotional environment is the security, the positive methods, the reinforcements and harassment and all those things which come into it. We'll discuss some of them in this one. While the intellectual environment practically is the learning with patience, they follow through the evidence-based and up-to-date knowledge and skills which the students learn and which the teachers impart to the students. Learning environment exists wherever and whenever students gather, and it includes various factors which contribute to the effective education and becomes the background in which the curriculum exists. Assessing the learning environments provide the basics for modifying the various elements of the learning environment. So because of those assessment of the learning environment, we can change the students' experiences regarding the teaching, learning, and the facilities which are provided to the students. These can be modified according to the feedback which we get about the learning environment. Overall evaluation of the medical education program should include the examination of the educational learning outcome. Whenever the people come for the accreditation of the course, they also want to look at the educational environment of the institute so that they can gauge how happy or satisfied the students and the staff is while working in that institute. The negative perception of learning environment results in fear and anxiety that may block the learning, while the positive perception of the learning environment leads to the feeling of attraction and interest, which may enhance the learning of the students. Modification in the program and the curricula, if it happens suddenly, it will influence the students' perception of the learning environment and consequently the learning outcome. So if there is a sudden change in the curriculum, anything has been suddenly modified, it gives apprehension to the students, and that can affect their learning outcomes, and that can affect the learning processes. The learning environment include also the situational factors such as the curriculum models which is adopted or the university is going to adopt, the quality of the teaching, the learning resources which are available to the learner, as well as the organizational structure and the leadership style. The leadership style is a very important component which can influence the learning of the student, because it also affects the teachers, that how the teachers perceive that leadership style and how happy or anxious they are while working in that institute. The technology input is very, very important nowadays. The Organization of Economic Cooperation and Development states that the governments and the higher education providers have invested substantial resources in computers, internet connections, software, and ICT, generally for the benefit of the students. So there's a lot of money has gone into that rebranding of the facilities, and practically they should be getting the reward out of that. Despite the potential enhancements resulting from technology use, the transition into a novel learning environment might be challenging. The change process is influenced not only by what the teachers do, but also how the students perceive and interpret what is being done. So it has to be to the satisfaction of all the concerned stakeholders at the place who are involved in the teaching learning process, as well as they are undergoing experiencing those changes. The educational goals of using technology in medical education include facilitating basic knowledge acquisition, improving the decision making, enhancement of the perceptual variations, improving the skill coordination, practicing for rare or critical events, learning the team training, and improving the psychomotor skills. So a lot of technology is involved in achieving these characteristics for the students, uh, uh, which we'll be discussing a little bit more in detail later on. Many technology-based learning environments are designed to support self-directed learning, which is the word of the curriculum nowadays, that because students being the adult learners, they have to be self-directed, and most of the burden of learning is on the students than on the teachers for teaching them. The information handling, collaborative knowledge building, and to promote deep understanding, all these technologies are very, very helpful. Then there is a term called as the innovative learning environment. And an innovative learning environment is the one which is capable of evolving at a micro, mean at the level of a person. The meso means at the level of the faculty, and the meta level, which is at the level of between the faculties in the university, and adapting and as educational practices evolve and change, thus remaining future focused. So practically this is one of those environments in which everything is not very solid, it's not fossilized, it is vibrant, and it can change over time as the new things and new approaches they come. The learners as core participants are encouraged active engagement to develop in them and understanding of their own activity as learners. It actively encourages well-organized cooperative learning. The lecturers are highly attuned to the learner's motivation and the key role of emotion in achievements. All members are acutely sensitive of the individual differences, including their prior knowledge. It is very important that we understand that when the students join the institutes, their prior knowledge is different, because now we are taking even the graduate students or the students of the which are of a more age group, of a higher age group than the normal school leavers, which were 17, 18 at one stage. Now you can get the students at the age of even 30 and 35 who have joined a medical school. The academicians devise programs that demand hard work and challenge from all without excessive overload. And there is a clarity of expectation and assessment strategies which are deployed with strong emphasis on formative feedback, which should be given very, very regularly to the students as well as to the staff about their performances. The strategies strongly promote integration across areas of knowledge and disciplines, as well as the community and the wider world. So practically everybody is aware that these things are going to be utilized in the future processes. The smart learning outcome is the one which is more technology dependent, and it is smart because it is effective, efficient, and engaging. Based on characteristics of human intelligence that might transfer to technologies, a smart learning environment is one that has several of the following characteristics. It has a knowledge which is access to pertinent information and the ability to add and modify that information. It may have the task support, the ability to perform a task, or provide a learner with tools and information that is needed to perform a task. The learner sensitivity is taken into account, the ability to maintain and make use of the profile of the learner so as to provide appropriate support and knowledge as and when required. The context sensitivity, the ability to recognize specific situations, including those situations in which learner might be in need of assessment, where you can do the scaffolding for the students. The reflection and the feedback, the ability to critique a solution or performance and or to provide meaningful and timely feedback to the students so that they can progress in the learning task. The personal learning environment is another type of an environment. In order to align with the rapid changes of the new knowledge intensive era, the fundamental shift is needed towards a more personalized, social, open, dynamic, emergent, and knowledge pull model, in which the students pull the knowledge towards themselves, as opposed to the one size fit all centralized, static, top-down, and knowledge push models, in which practically the teachers are pushing the knowledge towards the students and thinking that whatever they have told to the students will be learned by the students. So practically what is happening over here, that there are a lot of resources available now, a lot of medias available now with which the students can connect with the other students in different parts of the world, anywhere and everywhere. So practically, if you look at the lifestyle of the modern students, they are connected so widely with other people that it's a sort of a huge network in which they are working and in which they are learning. So all learning is self-directed. That is being stated. The learners may not have control over what is taught, but the learner always have control over what they are learning. The personalization means the ability on the part of the learner to learn the ways he or she deems fit. The learners need to have a system that is centered on what they want and need, a system that is adaptive and responsive. Personal learning environment is a combination of tools, people, and services that make up individualized resources and approaches to learning. And they are based on the context that learning will take place in different contexts and situations and will not be provided by a single learning provider. But teachers are not the only source of learning. The books are not the only source. There are huge medias and huge softwares which are available, which can enhance the students' learning. It's all through computer and the networks. What is the course? The bird eye views of the course. The institute culture. The university is a habitat, a society, a community, an environment, an ecosystem. It should be judged by the quality of the life that it fosters, the opportunities for growth, experiment, and exploration. It provides the concern for growth and enrichment and for culture that is exemplifies. That is of the culture by the Jan in his article. The institutional culture codifies institutional beliefs and values and influence the behavior of the organizational members. Values and norms of the institutes are presented in formal policies and informal procedures. There are a number of formal policies on which the institute works. Some of them which are pertinent and very important is, for example, like student admission policies and criteria, student advancement and graduation policies, the policies of practices related to learner and staff mistreatment and teacher-learner relationships, evaluation and promotion policies for the faculty and the faculty reward systems, policies on misconduct by the student or the staff, policies on plagiarism, university health service and education provider agreements, because in most of the places, the hospitals are not the part of the universities, and there is agreements, mutual agreements between the government and the institutes to use those facilities, those hospitals for the teaching purposes. So they should have a proper deal which is being agreed upon between these two institutes. The university survey of the health service staff, the people who are the employee of the hospitals, they are providing the services to the university. So how are they doing, and what is their requirements and all that? That is very important that we are aware of their contributions and what is their demand. The characteristics of the course: a democratically conceived curriculum is based on the needs of the society. It is complex in detail with logical sequence of subject matter that complements and cooperates with end users' need, with its educational quality and administration flexibility through its ability to evolve. So practically, the curriculum cannot be the same for all the institutes. A curriculum which is developed for one institute, which is, for example, in a very remote area, has its own specific requirements. So it cannot follow a very standard curriculum which is being conducted, say, in the metropolitan cities. So each curriculum, it should be able to evolve itself and should be able to incorporate the needs of the end users of that area, of that community, to be more environmental friendly for the people living over there. As economic development is tightly associated with higher level of education, the governments want that the students should be educated. Goal is to bring as many students as possible to the standards required. rather than focus on just the need of the most able students. So practically, it's not that only the high brass students, the A graders will get the admission in the medical school. It will be the other students also which will be provided those facilities. So hence it means that we have to find ways of helping a wide range of students from very different levels of ability and or prior knowledge to succeed by scaffolding in learning. So the students, as I've told in one of the previous slides, even the students who are graduates, who have done their studies in some other field, are joining the medical schools nowadays, and they are doing well with a little bit of assistance from the universities. A combination of a good curricular design and an appropriate use of technology will greatly facilitate the personalization of learning for these people. Part-time working students on and off campus, distance learning modules, online learning modules, self-study packages, and short courses, in which the physical presence of the students is not all the time required. The curriculum is an environment, educational and organizational, which embraces everything that is happening in the medical school. Educational environment is the most important determinant of an effective curriculum. A study of the curriculum is largely dependent upon the study of the environment, which comprises or are linked with the curriculum. So there are formal curriculums which include the learning outcomes and competencies of the educational program, explicit learning experiences, balance between the subject area which is taught, and evaluation designed to assure attainment of the learning outcome and competencies. This is the formal curriculum that is required to be delivered and mastered by the students. Informal curriculum, on the other hand, includes extracurricular activities, games, storytelling, discovery, Google search, communication with peers, online communities, work on problems together, and sharing the learning resources. So this is informal, which will not be examined per se, but which forms a very important part of the learning process of the students. While there is a hidden curriculum which includes the actions, behaviors, expressions, or implied attitudes and values of the faculty, supervisors, peers, and others, from which the students learn and imbue those attitudes slowly and gradually, and they tend to be, they make somebody their mentor or their role model, and they tend to follow those persons. Or these are the unofficial rules that guide action within the given educational setup or the program. The curriculum must be responsive to the changing expectations and values in education if it has to remain relevant and useful. New concepts in curriculum, for example, PBL curriculum, which is no more new, it is more than 50 years old, the spiraling of the curriculum, integration of the curriculum, outcome-based education, community-based education. Nowadays, more in concepts are the competency-based education and the interprofessional education. These are all the different components of the curriculum. A more forward-looking view of the curriculum puts emphasis on the learning outcomes, teaching learning methods, the content and its sequencing and its assessment. Now, if you look at this timetable, when we were students, we were just told that from this time to this time, there is going to be a class in anatomy, and that will be, there were fixed places for the anatomy lectures and for the physiology lectures and for example, biochemistry lectures. Now the timetables are more vibrant. It gives the students the more interactive details of what will happen, how it will happen, and when it will happen, and who will do it. So if you look at there is a anatomy lecture will be at the lecture hall 3, lecture hall 1 is the lecture number 3 will be conducted in the lecture hall 1, and the lecturer is the name given, the abbreviations given. The STL time is being identified, the ECE time, and what is the type of teaching learning method it is. It is the early clinical exposure that will be done. Who will be involved? The all path staff or all concerned anatomy staff and the surgeon, etc., etc. So all this information is provided in the timetable. These timetables are strictly rigid. And if anybody wants to make any changes in them, they have to get the prior permission from the module coordinator or from the deputy dean. The reason being the topics have been sequenced in such a way that they make the logical flow of the integration. It starts with anatomy, goes to physiology, biochemistry, then goes to pathology. And in between the practicals are scheduled, and there should be some specific the STL times, which are specified by the accreditation bodies. 20% of the time should be for the STL. So all those provisions are taken care of while preparing the curriculum. So developing a timetable itself is a huge task, which is done by the staff members. The learning outcomes have been identified for all the teaching learning sessions, and they have interrelationship with the learning environment and the learning process. The learning outcomes of the undergraduate students are influenced by many factors, including the learner characteristics, the quality of the learning environment, and the learner approach to the learning. Learner characteristics take into account learner's personality, the prior knowledge and academic ability, as well as what predicts the academic achievement among undergraduate students. So there is an interplay of these things between the students and the lecturers and the learning environment, learning process, and learning outcomes, which actually tells the student how good they are in their achievement of the learning outcomes. For each learning outcomes, there has to be a content. The learning content is defined as the topics, themes, beliefs, behaviors, concepts, and facts, often grouped within each subject or learning area under the umbrella of knowledge, skills, values, and attitudes that are expected to be learned and form the basis of teaching and learning. This is the definition of UNESCO. The outcome dictates the contents and not otherwise. It is very important to understand that it is not the outcomes which come first, the content which comes first. It's the outcomes which come first. So whenever we are developing the curriculum, the outcomes are identified first. And to achieve those outcomes, what is the content which should be included over there? That is being identified. It's not other way around, because in that case, each subject, each discipline will take the upper hand, and they will want to put all the topics of their interest into the curriculum, which will make the curriculum very much overloaded. Whilst designing the course or preparing the learning material, think what specific content add values to the overall goals of the course. What content is essential for meeting the learning outcomes, and what is desirable but not necessarily obligatory. This third component is the one which can be moved around, and you can replace it with the things which are more important, which are newer development, which are more pertinent. The width and depth of the content, the rapid growth of scientific and technological knowledge increasingly challenges the idea of the fixed body of content that student must learn. So practically, if the medical bodies, the accreditation bodies, they have specified the curriculum that these are the things which should be over there, it should not be the whole curriculum they should be dictating. There should be a place for flexibility or for the newer developments to be incorporated in the curriculum, and similarly some things which can be removed from the curriculum. So the professional body should specify only absolute must-know core, and the part of the curriculum is always fluid, which can be removed to accommodate the newer development. The learning experiences of the students, a wide variety of experiences across different contexts and settings, which transform the perceptions of the learners, facilitate conceptual understanding, yields emotional qualities, and nurture the acquisition of knowledge, skills, and attitudes. This is again the definition of UNESCO. In educational setting, learning experiences are challenging, engaging, interesting, meaningful, and appropriate to the learning needs. Until and unless they're engaging and interesting, the students will not be impressed by them. The previous learning experiences are the key factors which will predict the further learning of the students. It is expected that university graduates have developed as a person and acquired a range of intellectual qualities so as to be capable of performing outside the confines of what has been taught in formal courses. So they are not only learning the core content, they can explore the things out of that core and advance their knowledge. The instrument that access the university students' experience, there are 3 of them which I mentioned over here. There are a number of other methods of assessing them. The assessment of the students. Other than learning process, assessment affects other aspects of the educational process, particularly the teaching, the learning material which is given to the students, or the design of the learning environment. Factors that affect the students' performance in examination are many, and they include the parental supervision, very, very important. A strong family bond and support is very important in the good achievement of scores by the students. The teaching factors, good teaching methods and strategies, availability of academic staff for discussion, availability of learning resources, and hands-out, these all affects the results of the student. The learning style of the students, their diet, their physical activity, their sleep, the pertinent use of media, how much time they spend on media and how much time they waste on media, these all are important factors. Physical environment, the place and condition of residences where they are staying. Most of the students, for example, in Malaysia, they prefer to stay in the hostels. And so what is the condition of the place where they are staying? The quiet and comfortable learning environment is very important for preparing for the test and examination. The psychological factors, the anxiety, pressure of meeting expectation of the parents and other family members, the ability to bear stress, the burnout, and the internal motivation all play a role in the passing of the examination or getting the good scores. The peer support is very important. Academically competent peers can help the students, help their friends who are not that up to par, and they can pull those students to achieve high grades. The functional study groups and the guidance of the seniors is also a very important component. The peer pressure plays a very important role in the learning environment, in assessment environment of the students, which includes the behaviors like smoking, drinking, and taking drugs, which is a menace in some of the universities and some of the places. The students. The learning style of the students is very important. The learning styles are a combination of characteristics, cognitive, affective, and the physical factors, which serve as relatively stable indicators of how the learner perceive, interact, and respond to the learning environment. Learning styles are associated with differences observed in how students approach a learning task and how these affect their learning. The knowledge of one learning style can be used to increase self-awareness about their strengths and weaknesses as a learner. Normally, what happens is that in few of the universities where I have worked, during the induction week, we do a survey of the learning styles of the student, and we will check which is the most predominant learning style in the class, and we will try to cater to the needs of those. And then for the students who are not, who don't have that predominant style, how do we help those students? But it depends upon the student number. If the student number is very, very huge, then it will be very difficult to give a personalized sort of a treatment to all to the different type of students. So if the students are visual learners, this is the method which is commonly used, the sensory component of the method of assessing the learning style of the students. The visual learner uses, if they are visual learners, use many visuals, many pictures, many diagrams, show the learning objects more clearly and from different angles, and rotate it and show it. For example, if you are showing them a specimen, they should be able to see it properly from different angles. Show the technique from a number of different angles and encourage students to move around to find the best view while conducting the practical. Sometimes you get irritated that the student is moving a bit too much, but probably he or she is looking for a best view to understand what is going on in the practical. And do not force the student to stay in the fixed places during the practicals, especially. The auditory learners, let students arrange themselves around you in their own way, so that if they are hard of hearing or they want to listen more properly, then let them to be more closer to you than the students who are the more visual type of learners. Let students ask questions, speak clearly and completely, give complete instruction, ask questions, ask them to read the text aloud, use verbal analogies, the storytelling, or the mnemonics. There are many ways in which you can help the auditory learners. Kinesthetic learners are the doing type of learners. Give space to them to feel and touch the particular details of what's happening. Give them practical or hands-on activities, the assignments they do very well. If they have to find some information, they are very good in doing that. Ask them to draw, design, and construct the things, make theory with practical, let them move around and engage them in projects. The learning process is influenced by the way in which the students goes about learning and studying, and the conduciveness of the learning environment, which is critically important to successful learning. Elements of the learning environments are related to academic achievement, the course satisfaction, and the aspiration of students. In achieving a successful curriculum, the learning environment dictates what and how the students learn. Student perception of the curriculum also plays a role in the quality of learning. Among the various factors, engagement of the learner plays an important part and is dependent on their motivation, willingness to learn, and the perception of the subject relevance. And that will affect the learning experience. It's very important that what the student think of that subject, that topic, whether they should be learning it or not. And sometimes we take the feedback when we take the end of the module feedback from the students, they will tell that they think this topic is of no use to them and they don't want to. This happens in one of my previous universities when we were, the journal module, the first module was being given, which is practically the introduction of the different components. And in that one, the statistics was introduced, the methodology, the research methodologies were introduced, and students thought it is unnecessary for them. They don't need them to be a doctor to do that. Then they will realize how important the research work is when they will move up in the ladder from year 2, 3, 4, 5. So practically then we have to shift it towards the end of the second year so that the student at that time are more receptive of learning those topics. So accordingly, you can shuffle with the curriculum according to the needs and understanding of the students. The students who perceive the learning environment are positive are more likely to develop effective learning strategies. Satisfaction with learning environment can encourage also to be good learners and vice versa. If they are not happy with the learning environment, they will try to do more superficially. The learning process again is a very complex thing, which is influenced by the departmental characteristics, the student characteristic, and the teacher's characteristic. This is the modified from the Newell and Twistle model of processing of teaching and learning. The student characteristics are going to affect the learning styles, and the learning styles are going to affect the learning approaches, and learning approaches can be surface, deep, or strategic. Surface approach is when they just memorize the things. The deep is when they try to understand it, and strategic is when they float between the surface and the deep according to the requirement of the time or the requirement of the subject. These are the more smart students. The learning process is for these students will be either memorization if they're surface learners or understanding if they are the deep learners. The learning outcomes, the qualitatively, quantitatively, institutionally, these things are influenced. The learning outcomes will come out of there. And there will be the departmental characteristic which will influence the environment as well as the learning approaches. There will be the teaching characteristics which will influence whether the students will become the surface and the deep learners. And of course, there are the course characteristics which will tell you whether the student should be doing the surface approaches or the deep approaches. Students are smart enough to decide between these things. The clinical learning environment provides students with an important bridge between academic learning and the workplace, and also provides opportunities for skill development and engagement in enhanced learning experiences. The clinical placements are the most influential learning experience in the student's life to becoming a competent health professional, allowing for socialization into the profession when they are not only talking to the patients, they're talking to the patient's relatives, they're talking to the other staff members in the hospital, they're talking to the seniors and the junior and the junior staff members in the hospital, among the hospital staff. So they are being exposed to a lot of person, and that socialization practically brings in a lot of changes and a lot of development among the students. The GMC report highlighted that problems such as bullying, gender discrimination, harassment, quality of supervision, and the presence of poor role model among clinical teaching faculty in 1993. And that practically has brought in a lot of changes in how the students
are being distributed in the clinical postings in different parts of the world. The domains identified as most challenging from the improvement perspective are the organization of the condition of the work, which is in which you are, especially if you are working in a hospital which is not the university hospital, and the time to learn with senior doctors during the patient care. Usually the time is lacking, and the senior doctors are usually very, very busy, and they move very fast, so students cannot cope with that movement of the staff. The supportive learning environment, which provides opportunities for students to practice skills and activities, are integral to continuous learning in the clinical environment. And elements of quality of clinical placement includes the culture for quality and learning opportunities, which should be given to the students. Effective supervision, communication, and collaboration should be the hallmark, and the resources and facilities will be there. And it's usually the responsibility of the university to provide a lot of facilities to the students in the clinical environment to safely sit at a place. There is some place for them to sit, there's some place for them to work. There is a small library, for example, over there to look for the books, or they have access to the internet and all that. So all these facilities should be provided to the students. The diversity of the student is a newer issue in which the people are moving very, very rapidly from one place to another, and that changes the whole dynamics of the university. So when working and learning with people from a variety of backgrounds and cultures, students gain a comprehensive understanding of the subject matter. It also teaches students how to use their own strengths and point of views to contribute in the diverse working environment. The diversity relates to different races, the ethnicity, religion, economic status, sexual orientation, gender identity, and the language backgrounds. Educational challenges posed by family background, socioeconomic context, the migratory status are not only strongly linked to students' performance, they determine students' performance over and above the institute's influences. So these are very, very important indicators. How the university tackles with them, how the faculty tackles with them, the one concept is that everything is homogeneity, the differences are not acknowledged at all. So learners are grouped in one kind of educational environment and perceived to be similar, and therefore get the same sort of treatment, which is practically a bit of a handicap for the students who have come from the environment in which they are not familiar with those two sort of situations. The heterogeneity is when the differences are seen as a challenge and they are dealt with, so that some adjustment are made for those students which are from the different backgrounds. They feel comfortable over there. That's all. While the diversity is when we see the differences as an asset and an opportunity to learn from each other. So learners are perceived to be different, and these differences serve as a resource for mutual learning and development. Everybody bring with them their own prior experiences and the learnings they have done in the different places, and that can be an asset for the further learning of the students. What the teachers are supposed to do over here is to get to know the students, to maintain the constant communication with the students, acknowledge and respect every student's acknowledge and respect every student, and practice cultural sensitivity and give students the freedom and flexibility to show their inner strength and show their learning experiences. The mentoring of the student is another component. Is the relationship between two people with the goal of professional and personal development. Mentor supports and encourages mentees by offering suggestion and knowledge, both general and specific, to help improve their skills and advance their careers. Mentoring of senior student by faculty and near peer help provide support and improve the learning environment, as well as the level of preparedness for future clinical practices. That is done in the clinical GS. But there is a need for institutionalized mentoring and supervision practices. It should not be left to each mentor itself that this is the mentor style of doing the mentoring. I think there should be a specific pattern of a specific method of doing the mentoring for all the students, and the relationship with supervisors is an important aspect of the clinical learning of that. Good practices regarding mentoring include the mentor-mentee committee with specific roles and responsibilities. So there is a committee who is looking after all the issues of the mentors and mentees. All students are assigned a mentor in a group of 5 to 10. The 10 is the upper limit. More than 10 is becomes a little sort of a burden for the teaching staff, and especially the clinicians who are also doing the clinical work. Mentoring is scheduled in the timetable. So over here we do it once every week. So say every Friday in the afternoon, there is a mentor-mentee session. And at that time, the staff is having no teaching activities. So all the students are free to meet their mentors. The mentoring session is recorded in the mentor-mentee record book. So that becomes a sort of a legal document, which can be utilized in case of the need when suppose the student fails and he or she claims that he has been doing very well and there was no guidance given to them and blah blah, and then in that case the mentor-mentee record can play as its role as a legal document. The mentoring session is recorded in this record book. The students' results are given to the mentors for discussion and feedback. So in some places the results are not pasted on the students' notice board. They're not displayed on the notice board, and the students, and the result goes to the mentors, and they have to come and see the mentors to get those results. Each mentor designates 1 hour per week for discussing academic issues. This is flexible time. They can have, but whenever they have the free time. So, but that time is fixed for each mentor, and they can ask their mentees to come and see them at that time. Meet the student slot is available daily for immediate action, and meet the dean session is conducted in some of the universities after every 3 months for general discussion. And in this discussion, the students really pour their heart out to the dean to tell them what problems they are having and how they are perceiving the learning environment. After the mentoring is the monitoring of the students. Student perception of learning outcome is found to influence their behaviors. Significant differences are seen in the students' perception of learning outcome, learning environment between academic achievers and underachievers. Detecting and remedifying unfavorable attitudes are practically tricky for the staff. Faculty is reluctant to become involved in teaching and assessing professional attitudes and behaviors, as there are consequences of teachers' negative evaluation of the students, and if they negatively evaluate the students, there is a fear of litigation and appeals for the students, and concern that there are the fragile process backing up such actions. This is being highlighted in a number of the articles which I've read over the past few weeks. So practically the staff member really over here feels stressed out to say anything bad about the students. The medical faculties need to allow fair, valid, and unbiased procedures in assessment, feedback, access to remedial help, and if needed, the final dismissal of the students from the course. A survey identified 3 main areas of difficulty causing students' academic failure. Psychiatric problems, depression, and substance abuse is quite common in some places. Problem attitudes and behaviors and difficulties related to having English as the second language. This is again one problem in few institutes. The student aspirations is the student's ability to identify and set goals for the future while being inspired in the present to work towards these goals. Construct of inspiration has then 2 major foundations. One is inspiration, that is currently what you are doing is for the future and you enjoy that. And ambition is what you want to become in the future. So to achieve your future goals, which might be 5 or 7 years later on, you start working today because that is what your ambitions are and what your inspirations are. Learning environment is related to academic achievement, course satisfaction, and aspirations. Communication, motivation, social engagement, research exposure, internalization, student exchange, and career exposure are components of learning and environment for aspiration. That has been identified by students in the studies which was published by Roslyn et al. In 2018. The university or the faculty and initiatives to achieve these targets include the medical council recommended courses are given to the students, eminent scholars lecture series in which they call the people from diverse fields and that give them the students some motivational talks. The journal club is open for all clinical students. The career counseling is given to the students who, on a regular basis. The courses on IPE, communication, leadership, professionalism, etc. are conducted. The research-oriented electives the students select foreign universities and hospitals, and MOUs with international universities for students and staff exchange, community projects under the community medicine. All these practically are going to engage the student and help the students in reaching their aspirations. The academic success of the students, there are few terminologies which are given in the literature. Academic achievement and academic performance is the extent to which a student, teacher, or institute has attained their short or long-term educational goals. While the academic success goes even further from that. They have not only got their course completed, they have also advanced it as a postgraduate student. It is part of their occupation, or they are working in that field with which they are very happy about. So that is the academic success. For example, if the doctor becomes a doctor, spending so much time, and after that starts doing a business, so practically that is not academic success. He has achieved, or she has achieved this, but it's not successful in pursuing those careers. Learning education impacts academic achievement, seen as grade and performance, psychological health and satisfaction. Regarding academic success, self-efficiency, self-control, motivation, expectancy, goal setting, emotional intelligence, and determination are affected by social environment and the teacher's influence. All these will be affected by teachers' motivation of the students, how they handle the students. The organized extracellular or cultural activities show positive relationship with the high academic performance. These activities lead to civic engagement, identified development, positive social relationship and behaviors, and improve the mental health. So when the environment is already multi-ethnic, multi-religious and all these activities practically reinforce the academic success of the students. The feedback to the students. The research has shown that the use of peer and online feedback, novel approach, helps students to be reflective and critical thinkers. In most studies on learning environment, students' most negative response was on feedback by the lecturer for all years. So all the studies which I have read through on, in the process of preparing these slides, the students were not very happy with the feedback by the lecturers. Regarding assignments, students lack confidence in their ability to complete work independently. So they want the feedback to be given when you have given the assignment to the students. You have to mark it and give the feedback to the student. Increased reassurance improves students' self-confidence. The peer marking will save time of the lecturers. If you don't have the time, you can involve the peers, the students marking the other students will save your time. Collection of assignments on different dates can be done. So you don't collect all the assignments on one day, you stagger it, and in that process you can give the feedback to a group of students only. At one time, reduces the pile for marking, and whole class feedback where common mistakes are discussed benefits all. For clinical clerkship, feedback is best given regularly during and after interaction between student and patients and at the midpoint of the clinical clerkship. As for assessment, along with the timely and precise feedback, it helps the students to reflect accurately on their strengths and weaknesses. Students required to develop the skills necessary to become independent learners. The GMC thought that the students are not adult enough to develop skills necessary to become independent learners. So they should be able to assess themselves for that. But generally speaking, what happens is that, for example, the practice over here, mostly in Malaysia, is that soon after the examination, the feedback is given to the student, which is in the form of what they have performed. The students know what they have done in the examination. The question paper is displayed on the screen, and each question is discussed that this is the correct answer and why this is the correct answer and why this was the false answer. So if the student remember how they have performed, then they will be able to understand their mistakes over there. And the second feedback is given after the results when they are shown the whole detail of the results. So this is one of the feedback slide over here. The most important is to get regular feedback from students on how they experience the learning outcomes, the learning environment. So one is the timetable schedule and rescheduling. Second is the learning sessions, learning materials, assessment methods, mentoring sessions, technology use, and resources. The first top one, the graph is the lecturer's content were relevant to the learning outcome is telling you how the students, the lecturers have performed. So the students are giving the feedback about the lectures. The second is the interaction sessions were conducted on schedule or not. Lower down, this is, we have discussed all these things, is the student academic progress, in which the medical education department prepares this graph of the students' performance in each and every module and each every posting. And you will see how the students are progressing. This is given to the mentors before, when the results are given to them, and the students these things are discussed with the students, because otherwise you wouldn't know how the students have performed in the previous modules when you are giving them the feedback of the current module. The second graph over here will tell you is exactly copied from the result sheet for student, and it tells you the areas where the students were, the gray areas tell you the students which were in which the students were not performing very well. So the students will know that, for example, in SEQ, you will see a lot of gray areas where the students were not good in answering the question of SEQs. So you can give the student feedback of how was their performance and all that. Social emotional learning is the process by which each student develops their capacity to integrate thought, emotions, and behavior to accomplish important social tasks. In this sense, students develop skills that allow them to recognize, express, and manage emotions, build healthy relationships, establish positive goals, and response to personal and social needs. Generally speaking, when the students, for example, when they're staying in the hostels and they come from the different background, they take a lot of time in adjusting with each other. So if they have this social emotional learning process they go through, and at some stage, then they will become even the best friends and accommodate each other. So these sort of things are encouraged in the institution by different ways. So develop culture of study groups during and after the working hours so that the students can interact more with each other. The peer learning teaching promotes the social bonding among the students. Make few groupings for different small group sessions. Like if you're using the same grouping for all the activities, the students are stuck with those 10 or 12 students with which they are going to communicate. Make different groupings so that they can have a wider range of social interaction with people, the PBL, the lab groups, the STS group, community activities, all that. If they're doing with different students, they have a wider interaction. Observe students' personal growth, social skills, attitudes, and other general competencies and guide them for holistic development. Make PPT activities more interesting by role plays, video sessions, open discussions, and debates. Interprofessional education promotes sharing of interaction. It is a very good way in which you can learn more about, for example, the nursing staff, the pharmacy people, how they work, and all that. And it's a very interactive session. Practically, I was organizing it for one of the universities, and it was really fun to have those interpersonal education sessions. Promote reflective learning for interactive session and give feedback. Help students in goal setting and develop buddy system along with the mentor system. Buddy system is practically senior students mentoring the junior students. It is also called as the big brother in some of the institutes over here. So big brothers, big sisters, or the buddy system, whatever. These help in the students' adjustment in the new learning environment and in their emotional stability and emotional development as well. Stress is common among the students. The state of an individual, both mental or physical, that results from the interaction of the individual with a psychological environment which is perceived as threatening or threat to the well-being of the students. Emotional and social conditions of the institute make psychological environment that affects well-being of the student and the staff. A calm, supportive environment is prerequisite for successful learning. Adverse experiences during medical training have been reported to have long-term effects on the students even after their graduation. Key information about counseling services or academic, financial, and psychological issues should be provided during induction to the students in student guides and reinforced regularly. For example, there is some posters are developed which are displayed at a strategic location in the university, say near the lifts when the students are coming up and down, and they have to wait over there. So these information are provided to the students over there. It's very important that students know when they are stressed where to go. Easy access to specialist teachers from many scientific and clinical disciplines is handy. I mean, a student is stressed out and is going through the psychological problems, the psychiatric problems in a medical school is really a pity, because there are so many clinical staff who are available over there which can help the students. Students should be encouraged to practice stressful incident reporting on harassment, mistreatment, etc. for remedial action. The burnout in the students. What is actually the burnout is the measure of the physical and psychological exhaustion and mental distress, which is catalyzed primarily by the occupational and the professional demands. There's too much of learning, the content is too much, there are too many examinations, all those things give burnout to the students. A supportive learning environment contributes to student well-being and enhances students' empathy, professionalism, and academic success. And the opposite occurs if the is not supportive, then the common problem which has been shown is that students are they have no more empathy with the patients. In fact, as many as half of the students related to unsupportive learning outcome. Significant negative relationship between academic burnout and academic engagement and academic performance is there, and empathy and sense of personal accomplishment they are affected. Three components of burnout are emotional exhaustion, feeling of emotional overexhaustion as a result of one's work, depersonalization, when the person really is no more thinking about what is happening to him or her, and they're just staring as a bystander and they don't know what to do, or the low personal accomplishment is the feeling of occupational stagnation, incompetence, and underachievement for the students. The mistreatment of the students is another very, very important component which can make or break the environment. Learners are entitled to interact in the environment that stresses acceptance, values diversity, requires respect for dignity and the interest of others, and is free from any type of harassment. According to AAMC, mistreatment occurs when behavior shows disrespect for the dignity of the others, or it negatively impacts the learning process and the individual's well-being. These can be intentional or unintentional. Mistreatment manifest as grading or other assessment is used in a disciplinary manner is a mistreatment. Sexual harassment or gender bias, belittlement or humiliation of a student, psychological or physical punishment experienced, or even if you have threatened the student with that, it's a mistreatment. Verbally abusive language, offensive remarks, calling names, being spoken of in an insulting manner is all an mistreatment. Inappropriate anger, showing inappropriate anger, shouting on the students, being asked to perform personal services, being denied opportunity based on discrimination, the race, religion, gender, sexual orientation, religion, disability. All these are mistreatments, and the students can complain about it, and that can become a big issue for the university. Regarding the staff, the teachers can make learning fun, interesting, exciting, and challenging, or they can make it awful, boring, painful, and useless. This is said by Doyle in 2008. Effectiveness of the learning environment depends upon the leadership, the infrastructure, and the quality of the trainers. Successful implementation of teaching learning depends on the belief and self-perception of the lecturers. Lecturers considered as more able peers should provide scaffolding to the students. Lecturers' strength in technology, such as wikis, blogs, social media, and YouTube, enhance student engagement in learning and stimulate reflection and critical thinking. The students are more open to those staff members whom they can communicate with at any time from anywhere. Personalized learning, like competency-based education, is a new domain which helps students develop skills including critical thinking, problem solving, etc. The lecturers have subtleness, power, and dynamics to influence the students from their activities or their experience of the curriculum implementation, and change. Those who share the power with students use indirect discourse and give students choice in their learning can more effectively get the students to engage in the task they designed to promote student learning. So it all depends upon the academicians, how they treat the students and how they make the things more fun for them. All transactions that take place between lecturers and students are important part of learning environment, and lecturers should constantly appraise and defend what they are doing in the learning context. Staff strength is an important contributor in the delivery of up-to-date consent and staff behavior in the class, because if the staff strength is not enough, the staff is already exhausted, so they are not paying too much of attention and too much of input in the class. Recognize global issues in higher education in developing countries, overemphasizing factual learning and authoritarian lecturers is a big complaint which has been shown in most of the surveys which we went through. And information, as an information provider, the information which is provided by the teachers should be valid, reliable, timely, fit for purpose, accessible, cost effective, sufficiently accurate, relevant, having the right level of detail, and is understandable by the user. Again, the staff also undergoes the stress as the student goes. So job stress are as a harmful physical and emotional response that occurs when the requirement of the job do not match the capabilities, resources, or need of the workers. Emotional and social condition of the institution which make up the psychological environment also affect the well-being of the staff. Medical lecturers experience organizational climates that is from the high brass, from the top management. Employees' dissatisfaction occur when expectations are not met, or non-conducive working environments lead to reduced productivity, decreased organizational devotion, and job discontinuation. The role-related stressors and conflicts among faculty members include too many tasks and everyday workload, conflicting demands from colleagues and superiors, incompatible demands of different personnel and organizational roles, inadequate resources for appropriate performance, insufficient competency to meet the demands, inadequate autonomy to make decisions, and feeling of underutilization. Those who are not given the work, even they are stressed because they are not given too much of a work to do. Staff violence and harassment, again, is, for example, this is one study which was conducted on the harassment and violence which occurs in relation to the COVID. So violence and harassment at work hurts everyone, not just its immediate targets. Other potential victims include work colleagues, family members, friends, patients, and clients. During an outbreak of COVID-19, the entire population is subject to increased stress level that can cause serious effects on the mental health of the people. Social stigma and discriminatory behaviors were found against people of certain ethnic backgrounds and nationalities, and even anyone perceived to have been infected with the novel coronavirus. This is the report by UNOS and UNICEF and etc. The higher mortality rate associated with epidemics, the distress, uncertainty about symptoms, the unavailability of the test kits, and the absence of vaccine and treatments can lead to acts of violence against healthcare professionals and others who directly care for the patient and their families. And when the people are encouraged to stay at home and when possible work from home, the risk of domestic violence also increases, particularly against women and children in this situation. For professional development, the teachers are role models for the students. Their action, attitudes, and enthusiasm will affect students indirectly. Thus, they must invest their time and energy in regular CME activities. Lack of staff development efforts in medical institution needs to be addressed adequately, as a very good physician might not be a good doctor. Training lecturers in educational techniques translate in better student learning outcomes. The professional development experiences that are research-based, thoughtfully conceived and delivered focuses on the right thing, and it impacts the learning. Teachers appear to be one of the key strengths of Thailand Teaching Hospital, for example, because of continuously improved teacher-to-student ratio and the faculty development that has been documented. The purpose of PD is to enhance the learning of challenging content for all the students, and the matching of the experts with the type of the students is very important when you are who is taking care of which type of students. This matching is very important. Please go through it. There are a number of a list of PD activities I have identified over there, but this is not the exhaustive list. Many more topics can be added in. The mentoring of the staff is another very important activity. Workplace mentoring is a cost-effective way for existing well-trained employees to provide guidance and knowledge to less experienced employees. Mentoring is crucial for new academics, many of whom have different early career experiences. Start of the professional career, professorial career is stressful. Graduates training does not prepare new staff to balance research, teaching, and services. These are the three jobs which the doctors have to do while they are working in the university. Career mentoring involves sponsorships, learning professional rules like promotion and tenure, sharing access to resources. Psychosocial mentoring involves listening, confidence building, and praise. The mentees facilitated in interdepartmental interactions, increasing the familiarity with the university culture and general professional development. Staff orientation sessions is conducted with the deans to help in this mentoring. The modular PD courses by university are prerequisite for job confirmation in some universities. Professional development workshops are conducted by medical education department regularly. Follow the senior colleagues academic sessions, which is didactic model is being applied in many places in which the junior staff accompanies the senior staff in their teaching learning activities, and they observe how the senior staff is tackling the different situations. Guide through instruction material development. When the person has developed the instructional material, they discuss it with the seniors and they modify it accordingly, which helps the staff in understanding what are the things which they have to discuss in the teaching learning activities. Technology support to senior staff members who are not familiar with the PowerPoint or slide making or accessing the other teaching learning materials in the computer. They are assisted to it, and student feedback for self-evaluation is very important to get. So if you get there are the questionnaires. If you get them, the feedback from them, that is going to help the lecturers to benefit. The teaching is face-to-face. Traditional learning that occurs in person, assignments, discussion activities occur in the classroom under the direction of the lecturers. There are some specific characteristics of the face-to-face learning. I think I don't have to go into the details of it. This is the traditional method of doing the things. But now we are doing more on the online environment. The learning occurs via the internet-based platforms, both synchronously and asynchronously. The synchronous and asynchronous methods have their specific characteristics, and they have their pros and cons. They have their good points and they have their bad points. And you have to balance between these points and see which are the teaching learning activities which you can do synchronously and which can be done asynchronously. The blended environment is another important, in which both the on-offline type of teaching takes place, integrates technology and digital media with traditional instruction like classroom activities, giving students more flexibility to customize the learning experiences. The characteristics of the blended learning is that some learning happens online where the students have control over the path and pace of at which they engage with the content, and some learning happens in the instructor-led classroom. Online and in-person learning is complementary, creating a truly integrated learning environment. Blended learning methods improve the students' experience. They are associated with reduced failure rates, improved learning, and increased engagement. It is proven to be a scalable learning model that simply works for diverse population of students. Examples: slow and fast learners. Instructors record videos for use as supplemental course material. The students record their presentation to get feedback from fellow students, and the students record themselves interacting with the standardized patients and all that, and then they can watch those videos again and they can learn better. The clinical learning environment for the staff, the national stakeholder consensus document identified overcrowded clinical environments, understaffing, severe service pressures, and clinical workload as barriers for learning in the clinical learning environment. Students work alongside clinical teachers. Effective clinical learning, and it is an effective clinical learning method, and is developed in the development of competency work ready health professionals. However, 80% of the clinical education occurs in inpatient settings, yet 80 to 90% of medicine is actually practiced in the outpatient arena. That was the observation. So practically, we have to utilize more of the outpatient departments to give a good clinical exposure to the students. The issues faced by clinical teachers in the clinical environment is the management of the individual learner and the group dynamics. They found it very difficult to manage the group dynamic over there. Management of the caseload. Sometimes you have too many cases and sometimes you don't have cases. So a low caseload poses challenges for creating practical opportunities, while increased caseload provides abundant opportunities for practice, but there is a time deficiency, so time difficulties there. Balancing the clinical teaching and the responsibilities is another issue with the clinical teachers. University staff is considered as a threat to hospital staff and specialties. The university staff is usually not very welcome, and in many government universities, many government hospitals, to come for the teaching. And the lack of teaching facilities for university staff in the hospital also hinders their active involvement or their satisfaction in the learning environment of the clinics. Staff survey conducted in UK on utilization of the District General Hospital for teaching and medical students report. It's interesting study, so that's why I'm showing it over here, that the teachers felt that, and they were enthusiastic at the prospect of medical students, although they realized that this would be intellectually challenging and increase time pressures. A majority felt that the arrival of students have improved the patient care and that their department has benefited from the students. Majority also felt that the planned doubling of the student numbers would impose an unsustainable department load and would compromise teaching quality. So the number of students which should be going to a specific hospital should be matching with the number of staff over there and the type and the number of patients which are coming in that facility. Coordination between the District General Hospital and the medical school is necessary. Increased student number would significantly impact the character of the hospital, will change the type of patients they are admitting, that will change, the admission pattern will change, and the management will also have to adjust all these things within their routine. So practically, this was a study in which they liked the concept of students coming into the district hospital, but they don't want too many students coming at one time, because that will affect their clinical work. Staff evaluation is another thing which is a bit of a tricky, because most of the staff doesn't want to be evaluated, but this is one way of knowing, like you are telling students their strengths and weaknesses. This tells the strengths and weaknesses of the staff. Is required for accountability, because medical education is expensive and has an effect on healthcare system. How a teacher approaches the task with the proper understanding of roles and passion for work, professionalism, and appropriate skill is critical for holistic delivery of the curriculum. Identifies areas for teaching improvement and to judge value of the teaching. The evaluation will help in that. Stakeholder satisfaction will occur. Students, parents, patients, accreditation bodies, organization, and funders, they all will be more comfortable with the situation in which they know how the students perceive the staff. Methods of evaluation is self-assessment questionnaires are there for student feedback. The rating scales are there to get the evaluation from the students. The criteria is that we should inform the staff member that he or she will be evaluated. Peer evaluation during teaching session or session recording. Sometimes one expert from the same discipline and one person from the medical education sit in during the session, then they give their evaluation. The medical education from the perspective of the medical education, and the subject expert from the perspective of the subject, that how the person has been performing, and what are the areas which need improvement. I think it's a routine practice which is done over here. Teaching material evaluation, the slides, the handouts, the clinical teaching, all that can be evaluated. Educational innovations which a person does also will tell you how the person is progressing with the profession. Teaching portfolio of the student of the doctors will help to understand what are they doing and how are they performing. Annual appraisal, promotion, grants, and PPD activities also is one way of evaluating the staff. Contribution in other academic activities like the leader or member of a faculty committee, the mentoring of the students, the supporting, the training the support staff, or learning material preparation, all that also contributes into the evaluation of the staff member. Infrastructure, I have just 2 slides on the infrastructure. One is on the technology. Podcast and videos with flipped classroom, mobile devices with apps, video games, simulations are some of the techniques which are available to address the change in the learning environment. A lot of things, gadgets are now available to improve the teaching learning of the students. Computer-assisted learning, online courses, flipped classrooms have a positive effect in the areas of student involvement, satisfaction, and knowledge acquisition. Mobile devices, the personal digital assistants are used for medical questions, patient management, and treatment decisions. Medical apps for iPhones and Android devices are available for problem solving, diagnosis. Digital games are used during surgical training to improve eye-hand coordination and reflex time. The Elder Quest is a program which is used for geriatric posting, in which you identify and find an elderly person, and then the students take care of that person going through different problems, the age-related problems. Simulation imitates the real patient. There are 3D anatomic models which are available, the clinical task, and they mirror the real life scenarios. Part task trainers or 3D body parts for both procedural and psychomotor skills. Integrated simulators combine mannequins and computers. So the mannequins are there, and then you inject a drug into the mannequin, and the computer will show what changes have taken place inside the body of that mannequin. It's a very, very high-tech gadget, but it helps the student in understanding how the body responds to different drugs and all that. Virtual reality simulators for surgical skill development are also one way of teaching the surgical skills to the students. The physical infrastructure is very, very important. Technological advances have enabled the educationists to construct buildings of their choice, fulfilling the specific needs. Purpose-built structure enhance their management and productivity. In education, the combined articulated vision of the architects and teachers have created integrated teaching and learning solutions. Facilities with comfortable seating, noisy, cold, or with uncomfortable seating, noisy, cold, or overheated rooms is not conducive for good learning. Accreditation bodies, they require structured teaching and learning physical facilities such as lecture halls, seminar rooms, multi-purpose laboratories, medical museums, library, dissection halls, clinical skill lab, examination halls, teaching hospitals, etc., etc. Learning equipment like microscopes, slides, mannequins, etc. is the requirement. Dissected, prosected specimens, and other specific requirements related to anatomy. Facilities for holistic development of students demand playgrounds, malls, computers, computer areas, etc. These should be provided to the students. Discussion rooms with IC facilities, staff and student restrooms in hospitals. Other facilities includes cafeteria, bookshop, medical clinics, student rest areas, and of course, neat and tidy washrooms. This is the last section of it, the bird's eye view on the learning and environment evaluation. How can we do that? There are a number of instruments which are available. These are some of them which I have put over there. These are all functional and they are all still used, although they are very, very old one also. So for this is one is the medical school learning environment survey, which access the 7 scales, has 7 scales for the assessment, which is done, which uses for different aspects of stress in the learning environment. Then we have the 50-item dream questionnaire, which measures the 5 domains, which is commonly used now for the students' perception. But the problem with this, the dream, is that it takes only the students' perception. It doesn't take the staff perception. Staff have their own perception of students in the learning environment. So it should that should be assessed as well. Student perception of the learning, students' perception of the teachers, students' academic self-perception, student perception of atmosphere, and students' social self-perception. These are the 5 areas, 5 domains in which it is being assessed. And the total score is 200. And I'll show you some of the research work which I have picked up especially for today's session. This is all done in the European side and in the Asia side. In America, there is a 28 option John Hopkins learning environment scale, which has been used. It has 28 items are divided into 7 subscales. It is almost the same like the dream. The dream, other than that it has included mentoring as a specific separate item. Then for the nursing, there are some. If we have some nursing people over here, these are some of the nursing ones. And for the dentistry, there are a number of skills. Normally, when we want to do some research, we are looking for the good skills. So this was just the idea to provide you with a list of some of those instruments. Now we do a comparison. This is the last component. What I did was that I went through a number of dream survey reports, and I picked those service reports which have some specific special sort of an element in them. They're coming from different countries, and they have identified their areas of weaknesses. And their questionnaire, they have included all the 50 questions and their responses in their study. Because I wanted to show all, and I want to compare all of those 50 questions with you guys for this presentation. Okay, so that was the inclusion criteria. No special choices, no special liking for any country. I went from Bangladesh to India to Iran to Malaysia to Pakistan and to Sri Lanka. Put them in the alphabetical order. So we start with the Bangladesh, India, IR, Iran, ME, Malaysia, PP, Pakistan, and SL is Sri Lanka. Asian countries which are either undergoing the changes or they have undergone the changes, and they're experiencing those changes now is the main concept over here. So for the student perception of learning, the areas which are marked red have scored less than 2, so that is not a very good way. But if you look at the overall score, the 25 to 36 is a more positive perception, which was the interpretation given by the dream people who have constructed that questionnaire. That if the score is between 25 to 36, it is a more positive perception. So for the Bangladesh, Malaysia, Pakistan, and Sri Lanka, the students think that the students' perception of learning is good. The second one is to student perception of teaching. Again, if you see that although there are some red areas, which mean that for that specific question, the students were not very happy. But overall, if you see that all the 6 countries, the students liked the features. Moving in the right direction, that was the second last best option. Students' academic self-perception. Usually for self-perception, students are quite strict in giving the marks, because they think that they are not happy with so many things. But still, 17 to 25 was feeling more on the positive side. 19, 20, 17, and 17 was the highest marks. The India and the Iran practically couldn't make it in this one because the students were not very happy with their own self-perception. The next one is the students' perception of the atmosphere. Again, there are some red areas in which the students were not very happy. 25 to 36 is the more positive attitude which was expected, and the Malaysia, Pakistan, and Sri Lanka are the three countries which fall into this, but they just got through it. And the students' self-social perception, only Malaysia, Pakistan, and Sri Lanka were scrapped through. The good mark, the 15 to 21 score of 15 to 21 is not too bad actually. So they went not too bad, but Bangladesh, India, and Iran practically were slightly below that level of 15. Okay, now what was the specific about the Bangladesh? In 2002, a new comprehensive curriculum was introduced in this country, but both students and the faculty found curriculum stressful to implement. At that time, the FAMER was working very intensively in some of the Asian countries, and probably they are the ones who have introduced this new curriculum, but it was not accepted. And when this study was conducted in 2010, the undergraduate curriculum was still in the traditional mode, teacher-centered, discipline-based, information gathering, and hospital-based with no options or no elective modules. This all is coming from the paper, so I've not added anything over there. I've just picked the latest, the pertinent points from the paper. The learning task is to reproduce the subject matter in the final examination. That was the opinion. The dream questionnaire was administered to 1,903 students in the clinical phase, that is 3rd to 5th year, 15 medical colleges. So it was a very huge study which was done over there. And the report you have already seen of that country. The remedial measures are needed in the subscales of student perception of atmosphere and the social self-perception for further improvement. Finding from this study may give guidelines for curricular planner and faculties and administrators of medical colleges for further improvement. If you look at the maximum dream score out of 200, they have scored 110.4. India, the medical curriculum is traditional and discipline-based. There are 9 semesters over 4.5 years. So the medical course is 4.5 years long. The preclinical subjects are taught in the first 2 semesters. The semester 3 to 5 are periclinical subjects, that is the pathology and pharmacology, plus exposure to medicine, surgery, gynecology, pediatrics, community medicine, and etc. The students in semester 6 to 9 are exposed to all the clinical subjects. So practically it is 1.5 year. It is 4.5 year course. So 1.5 year is only for the clinical subjects to cover. The global dream score of the maximum possible was 101, just got over the 50% mark. Improvement is required across all domains of the educational environment. Students of the 8th semester perceived the teaching negatively. The lowest scores were given to the support system, the burdensome course content, the factual learning. Thus, a hybrid curriculum that includes PBL might provide students with stimulating learning, was the conclusion. The structured clinical teaching with specific curricular objectives as well as mentoring of senior students by faculty and near peer might improve the learning environment for senior students. Iran is another different way of teaching. The course is 7 years long, almost half of which comprises basic sciences and pathophysiology courses, and the remainder is the clinical science course. Very lengthy. The course is traditional, based chiefly on the teacher-centered and hospital-based approaches. The curriculum, which comprises lecturers with specialized and practical courses, is not student-centered, neither involve learning problem solving, and is evaluated by summative final examination at the end of the course. So probably there is one final examination which is conducted at the end of the course. That is what I think. If anybody from Iran can can clarify this. It's only one examination for all the 7 years. It's going to be too hectic for the students. 182 students participated. The mean age of the students was 21.7. You see, the range of the age was 18 to 30 years. So probably they are having the graduate students from other fields as well. Male to female student ratio is as usual. The females were more, about 1/3 were males and the 2/3 were female. Basic science and pathology course represented 57.7%, while the 42.3 students were from the clinical sciences. The overall score was 99.6. So practically, most of the students didn't give very good, as we have seen in the tables over there. They were not very happy with the learning environment. This school follows the hybrid curriculum, which comprises of system-based modules in preclinical years 1 and 2 and specialty-based posting in clinical years 3, 4, and 5. So it's a 5-year course. There are 2 intakes in a year, and the students are a mix of Malay, Chinese, and Indian races. And there are few foreign students as well. So there's a good mix of students from different races. Students are self-sponsored or on government loans. The admission is on open merit with no quota system for any race. Medical students is year 1, 2, and 3 were included in this study. The majority were year 3, females and Malays in ethnicity. The students reported teaching as too teacher-centered. The teachers are knowledgeable and have good friends in the school. These 3 were their strength, in which they scored more than 3 scores. The scores for all 5 subscales showed positive perception of the study participants. Nevertheless, there is a need for improvement in all 5 domains of the educational environment, was their conclusion. The Pakistan, again, this was a study which was conducted for the preclinical students, 286 in number, of a medical college in public sector, but this college is in the underdeveloped remote area of Pakistan. And this study was done in 2018. The dream score was 113 out of 200, but this school has already done one dream study in 2015, that means 3 years earlier. In previous dream study, the result was low overall score of 90.4 out of 200. This led to addition of a new building block, creating Department of Medical Education, hooray, hiring more training staff and next changes towards student-centered teaching learning approaches. And because of these approaches and these all efforts which were done, the dream total score was increased from 90.4 to 113.68. However, current survey warrants further improvement in the area of student academic self-perception and the student social self-perception, especially students' perception of high failure rate and teaching of empathy. The last one is Sri Lanka. The curriculum is currently being reviewed. So they were reviewing the curriculum. This one is a bit tricky. Again, if somebody in the audience is from Sri Lanka, will need some clarification over here. The present traditional course run as terms of 10 weeks each. And there are 13 weeks, so 13 weeks course is given, 11 to 13, 10 weeks. So there were 130 weeks of total course is there. I don't know how 130 means 3 years? No, but this is minimum, but we have larger than that, no? So the preclinical phase of 4 terms is 1 to 4 weeks, 1 to 4, 10 weeks chunks. So there are 40 weeks, during which anatomy, biochemistry, and physiology is taught. 40 weeks means almost a year is in these 3. Biochemistry, anatomy, and physiology, more traditional. The periclinical phase of 6 terms is 5, 6, 7, 8, 9, 10 is parasitology, microbiology, pathology, pharmacology, community medicine, and forensic medicine, with introductory clinical appointments. While the clinical phase is only 3 terms means 30 weeks of medicine, surgery, pediatrics, psychiatry, family medicine, ops, and gynae. There was there's no mention of eye, ENT, anesthesiology, and etc., what we call as the minor postings over there. A total of 339 students of the pre and para and the clinical phase participated with the age range of 20 to 28 years. So the age range in the Sri Lanka has increased. Probably they have a much bigger time spent in the school stage. I don't know. Overall dream score was 108 out of 200, and the SPT, SAP, SSSP showed significant differences between phases, and 20 of the 50 items showed significant differences between pre and paraclinical staff. I think with that we come to the end of it. Thank you very much.
Thank you very much, everybody, for your attention. Thank you, everybody, for your attention. Some of the questions which I have noted earlier, we'll address that first. One is a bit more detail about mentoring record book.
Okay. Mentoring record book is a document which is prepared in which we record the visit of the students to the mentor, which is being scheduled or unscheduled. The scheduled meeting is conducted every week, so that is being recorded in which the students will tell what they have discussed with us, and we will write over there what we have advised to the students. So it is sort of a record in which the students discuss their issues. That is being recorded, and what specific advices we have given to the students, that is recorded. If we are giving them the students' result, we write over there what information we have provided to them, and how we have discussed and how much we have informed the students, and what the students' perception of it is. It has number of pages, and as you keep on, as the students keep on coming, sometimes the student come only on the week on those weeks, or sometimes they come whenever they wish to see the mentor. And all the scheduled and unscheduled activities are recorded in that record book, and that gives us evidence that they have come to see us. That is the things which we have discussed, and that is the information which we have provided to them. This becomes a document which is usually kept with the mentor themselves, and when the mentors, for example, they have left the university, they will pass it back to the academic office, and the new mentor join in, then the new mentor will get it. On the mentor-mentee record book, we have the picture of the student posted over there. Their contact numbers is in that book, and in the next to kin to which if you have to inform something, who should be informed about the students. So these informations are over there, and the students have they record, they write it over there, and when you have given them the feedback, then you show that feedback to the students that this is what we have discussed. You agree with that or not, or you want to add something? So generally, it contains all that information.
The next question is that how much weightage of student feedback in learning environment? In other words, what is the importance of students' feedback in improving learning environment?
I think the students are the main stakeholders. These are the ones who are the recipients, and their feedback is very, very important in all aspects, and we should take as much feedback from them as possible. We normally take, for example, the feedback after every module. We take feedback after every test or examination which is being conducted. We take feedback after every special occasion or special sessions which we have conducted, so that we know that the students are in line with the self-questionnaire. Yes, self-questionnaire also. We take the students the student give feedback about the lecturers also. That the lecturers' self-assessment is only stays with the lecturers. They are not discussed with the faculty, or they are not discussed with the other members of the department. That this is between the lecturer and the student. They will give you the feedback that how good you are, how they like your slides, how they like your presentation, whether you use the technology or not, or whether they are happy with all that. And that helps you in improving your yeah. Especially, for example, for me, I've learned a lot from those feedbacks, because previously I used to speak very, very fast. So they give me that, they give me the feedback that I speak very fast. So I have to then be conscious of it, and then I had to start to speak slowly and to cater to the needs, because the students are not very well versed with the English language, so they want us to speak in a special way. And because many of the staff members are from the different countries, for example, the people who have come from Russia, they have a different accent. The people who have come from the European countries or come from the Australia, they have a different concept, the accent. So practically, students find it difficult sometimes to follow the lectures.
Okay, thank you. Any other questions? Other questions from the participants? Before that, some of the members are requesting a copy of this presentation. We have already shared this presentation in the group, but if you have not received, you can send a request and we will send you the copy. So any questions from the participants? Yes, Professor Aslam.
Yes, please. Dr. Rukhsana Malik, thank you very much indeed for such two elaborative.
Okay.
Now, in the primary school, we learned that learning is the outcome of the student, parents, and teachers, which means home, school, and the student, him or herself. So there are a lot of variations at home, in the town, in the country, geopolitical, economical, and globally. So environment at home, environment in the town, environment in the country, and environment in the region, and then environment in the global perspective, they also must affect the learning environment, isn't it? So these various variables, how can we make a heaven in the hell?
Interesting question. Prof, the directly the learning environment is affected by the environment at the home for teaching learning purpose. If the environment at the home is not conducive, or there is a stress going on, or there is somebody sick over there, it definitely affects the students' teaching learning activities. They might not go to the universities. They might miss the classes. Sometimes the students resort to different type of drugs and smoking and all those things. So it does affect. The environment in the university, their condition of the residences, those students who are not staying in the hostel and they have rented out places outside is a free heaven for them. They can do anything over there. So practically that also affects the students. The students who are staying in the hospitals where they see the death and the dying and all that very closely, it affects their teaching learning activities. But the overall the environment of the country, until and unless students get really involved in that, if they are involved, definitely it will affect. When we used to have those student unions and all that, it was the hell actually, practically in the universities and the colleges. Now the schools are closed, now the schools are opening, now this is happening, and the people who are fighting among themselves, this all was there. But thanks God, in this part of the world, usually it is not a big problem, because there are no unions, but students' unions are there, but that is only for that university, and there is only one union, not the multiple people fighting with each other. It does affect. Obviously, for example, the current situation of COVID has affected a lot. The students are very stressed out about it, and the political and all those situations, they do affect the countries which are going through war. Actually, the students are affected, definitely. It affects.
Thank you very much.
But Professor, we may not agree with the comments 100%. We did enjoy as students the student union activities as well. Yeah, right. Any
Assalamu alaikum.
yeah, any other questions?
Assalamu alaikum. Can you hear me?
Yes, please.
Yeah, thank you. I'm Dr. Sabina from Saudi Arabia. I just wanted to thank you very much for this wonderful session, and I enjoyed it thoroughly. I just want to ask a question. Actually, being a teacher, sometimes people come and ask you, for example, if there is a brilliant student, he has got a chance to attend a wonderful university, a high-ranked one with a good learning environment, but he'll be away from his family, and he has some chronic diseases. So should they prefer to send that student to a better university with good learning environment, or to a mediocre university where he can have the family support and everything?
I don't know. It is the question of when you change the universities, if the student has to move from one university to other, there are multiple things to look at. Whether the course it matches with the other university in which the student is going. Otherwise, the student have to start all over again. Whether the financial conditions of the family is such that they can support their children, their child with the expenses which are going to incur over there, and with if the student is sick as well. Generally, I think it should be more nearer to the family than further away from the family. I think all the universities are good students. It is the students which make the university. So if the student is hardworking and can cope with it, nearer with the family, the better it is, because that gives you more mental satisfaction, and the family is also around. So it is a very good support system which is available over there.
Yeah.
Nearer is better.
Yeah.
I don't know. There's some other I'm telling you. I don't know what is that.
Yeah, and especially now we have got so many learning tools available online and resources.
So yeah, they can contact.
Yeah, thank you.
One, Dr. Ahmad. Yes, your question, Dr. Ahmad, your question, Dr. Ahmad Mishwani.
Sir, thank you very much, sir. It was very informative and interesting session. And for me, especially, it was very encouraging and pleasing, because in your studies, in most of the places, Pakistan was placed in a better place. So that was very encouraging for me and for my other colleagues, faculty people, and educationists who are involved in this medical education. I just have a comment regarding the learning environment, because it is not the facilities which are the only thing which can make an environment very friendly or pleasing. It is I think, in fact, if whatever facilities are available, they are utilized in a proper way. And the other thing is proper training of the faculty, if they can motivate the students properly, and then the coping with the stress, if these workshops and lectures are included in the curriculum, and the students are motivated and they are taught how to cope with the stress, that will also help. And similarly, this mentoring, which is increasingly being included in the curriculum and in different institutions, that will also help a lot in making the environment friendly. And of course, the apart from these teacher faculty development courses and other things, proper facilities, which are nowadays, I think the regulatory authorities are trying to ensure that proper facilities are available in all the medical institutions. So I think the things are gradually improving, and these are much better than the days when we were students. The present day students are very lucky. They have almost manifold facilities which we people used to have at our time of student life. Thank you, sir.
Thank you very much, sir. You talked about the facilities. We would like to actually restart as a medical student with these facilities. Yeah.
Sir, that I think that problem is also solved because in our days we were not taught that we have to be lifelong learner. We thought when we passed the final year examination, we thought that the thing is over. But later on, we came to know that we have to be lifelong learner and we have to continue to learn throughout our life.
Thank you, sir. Thank you.
Thank you, sir.
Okay, Dr. Anam Tahir.
Yes, Assalamu alaikum. Thank you so much, ma'am, for the wonderful, informative session. So my question is, it might be a very stupid one, maybe. So I'm a teacher and an instructor at the physiology department. So the implementation of the learning environment and all this might take years to develop, maybe in my institute. But take home message, what would you give a tip for me as a teacher? How can me as an individual contribute to a positive teaching environment? Should I take just my students, or should I collaborate with my department at first? The first steps I'm actually asking. Or should I go to the medical education department and talk about faculty development? What would be the first step according to you? Thank you.
Okay. Thank you very much for your question. The learning environment is modification of the learning environment is not a one-person job. It is always a collective effort, which will be done not only by your discipline. If you want to change the environment of only your discipline, for example, if you want to improve the delivery of the lectures to the students, you're giving the lectures, you can share your PowerPoints with other staff members and ask them to give you a feedback. And if they are really a good coherent type of a department, they will help you in developing those, because you are a younger person now and you have just started your career, for example. You will benefit from that, and they will be providing you with the feedback how to improve on that. These small things practically matter a lot while you have started the job. For the students, you can do the mentoring of the students. Students really like younger people to be their mentors. They want to follow the seniors as their role models, but they don't want the seniors to be their mentors. The reason being that most of the time, either they are not available or they are very strict. So with the younger ones, they can communicate better. So you can contribute in the mentoring sessions of the students. You can make some, for example, you can link with them with some group, your students, and they can ask you questions over there, and you can have a discussion forum with them. There are many ways in which you can improve your learning activities with the students, and they can benefit from you. It all depends how much time you have and how much time you afford to give to the students after hours. For example, in one of our universities, many of the teachers were living alone. So their families were in another country and they were all alone. So in the evenings, they were all free. So they kept on sitting in the faculty, and the students used to sit with them who are waiting for their parents to come and all that. And they used to teach them over there, which was a very good environment, especially just before the examination. They're discussing the question, and it gives a very good ambience to the university. And if you start doing that, to sit in an open area and talk with the students and ask the students if they have any difficulties or any problems, you can help them a lot. But to bring in some really realistic change in the faculty, it has to be a activity which is being monitored, which is being initiated by a group of people, and a committee is over there who will look after all these issues. Only then, legally you can solve them. I hope I've been.
Thank you so much. Yes, ma'am, it's very helpful. Thank you.
Thank you.
Dr. Fahad Azam.
Yes, sir. Sorry, I couldn't hear you. Yes, sir. So my question is about the practice of ragging. So in our times, we used to have this practice of ragging, and now in many institutions, this practice is seriously discouraged and it's not allowed. Many colleges are very strict about it. But sir, I believe that this practice of ragging, even though it had some downsides, but it did increase some sort of interaction between the old students and the new students. So should we have some ice-breaking sessions between senior students and the new class when they join? Do we have any structure in Malaysia or anything that you can recall for those ice-breaking sessions to increase interaction between senior students and when the new class joins? So this is my question.
Thank you, Dr. Fahad, for your question. Ragging, I personally think was not a very good way of welcoming the new students into the faculty or into the school. Yeah, in Malaysia we do have it. Actually, what happens is that when the new classes come, a group of students who are good students and who are good in interaction and communication, they are picked by the faculty and they help the students who have just joined to go through the different departments, to show them the different resources, to show them the different facilities which are available, the who is where. All that information is given by the senior 1 year senior students. Practically, if the new first year has come, the current second year students will help in those activities. They will take them around to the city as well if the students have come from outside, and they will show them the different departmental stores where they buy the things, and which areas are good to visit for food and all those things. They help the students a lot in this respect. They also help them in settling them in their accommodation in the residences, or what we call as hostels. They help them in the evening to settle down over there, and if they have any requirements, they will tell them. And actually, they are like the big brothers for them, and they will guide them in all those activities, which is a very welcoming way, because they practically, along with the teachers, are helping the students in the induction week to settle down over there. And sometimes they give the sessions to the students as well and tell them about the different ways of studying and all that in that induction week. So yeah, there are some specific ways of doing it, but ragging I don't think has any positive effect on the students. Although I missed the ragging, I was not ragged. I joined a bit later.
I can recall my experience, and honestly, I had few weeks of nightmares about this ragging. I think that was really very sort of unwelcome practice. And thank God, I think the things have been taken, because there was no limit to it. The many students would cross the limits, and you remember, in fact, some grievous injuries happened to the students in such activities. Right? Any other questions from the floor? Slide here. If none, I have to just show you two slides. The last two slides. Yeah, this is the information about the next webinar. We will skip the month of April because of Ramadan. So our next webinar would be in May, and that would be on blueprinting for assessment and curricular content. And we will be sharing all the information with you about that in due course. And finally, our usual request and appeal for a charity drive to donate $1 USD or equivalent amount in your local currency to any deserving individual in your neighborhood or any public welfare organization in your community. Thank you very much for your support and attention, and hope to see you again in May, inshallah. Thank you very much.